There was also the program on hypertension and diabetes. And if my memory recalls me right, nagkaroon po ng pondo ng 1 bilyon para po sa mga maintenance medication ng 3 million hypertensive patients and 1 million diabetic patients. Ano po ba ang programa na ito? There was an allocation of 1 billion for 3 million hypertensive patients and was supposed to increase, and diabetic patients totaling 1 million, a total of 4 million Filipinos. Ang intention po nito, every month, they go to the rural health center to get 1 month supply of maintenance medications based on the premise na napakamahal ng gastusin ng kalusugan at marami po ang hindi nakakabili ng maintenance medication. Ngunit, marami po ang kasamahan natin sa Kongreso at yung ating mga kababayan ang nagtaka dahil nawala ang programa na ito at hindi na mahanap kung nasaan ang pondo nito. Can we have an update regarding that program?
Madam Chair, may I request that the Chief of the Pharmaceutical Division be recognized? I think she's in the Zoom. Madam Chair, her name is Dr. Melissa Guerrero. To be recognized with your permission, Madam Chair.
Yes, Madam Chair. So tama po kayo, Madam Chair, meron po tayong Medicines Access Program po dati, nakalodge po ito doon sa Pharmaceutical Division, pero bandang 2016 or 2017, lahat po ng pondo ng Medicines Access Program para po maging harmonize siya doon sa Non-Communicable Diseases Program, nakalodge na po ito sa Disease Prevention and Control Bureau po. I think tuloy-tuloy naman po ang pagbibigay po ng medicines for hypertension and diabetes.
With that, Madam Chair, Honorable Secretary, kasi naririnig natin na tuloy-tuloy, pero naririnig naman natin ang reklamo sa baba na tila nawala siya. Because it was a monthly, once a month visit to the rural health center wherein the registered Filipino, indigent Filipino, kumukuha ng buwan ng gamot for maintenance medication for hypertension and diabetes. Ang tanong ko po, meron po sa programa ng DOH na wala ito dati, yung butika ng bayan, dahil napunta sa maraming utang at hindi nabayaran. Moreover, karamihan naman po kasi ng ating kababayan, walang pambili ng gamot. With the onset of sin taxes, sa pananaw niyo po, Honorable Secretary, ano po ba ang mas maganda? Yung pondohan ang butika ng bayan kung saan binibenta yung gamot sa ating mga kababayan, or pondohan na lang at dagdagan kasi marami naman yung may diabetes at marami yung hypertension, at kung kayo sa national government ang bumibili ng gamot, nagiging mura siya because of economies of scale. Do you think with this pandemic, where people are losing jobs, where people are having a hard life, it will be better that the budget will just be spent and augmented on the hypertensive and diabetes club so that more patients, ibalik natin yung 4 million na Pilipino na buwanan pumupunta sa RHU at ibalik natin na madagdagan ito. Because 60% of our population in the adult stages are hypertensive. Sang-ayon po ba kayo kung sakasakaling magdesisyon ang Kongreso at ang Senado at ang Pangulong Duterte sa kanyang administrasyon na tulungan ang gastusin ng maintenance medications ng ating mga may high blood at may diabetes? Are you amenable to this?
Secretary.
100% amenable, Your Honors.
Thank you very much. Madam Speaker, Madam Chairman, punta po tayo, Secretary, sa COVID. Ang COVID po kasi, will you agree with me that the #1 niche of population that they are attacking are renal patients? Yung inaatake ng COVID, karamihan, #1 nilang target are renal patients or patients undergoing dialysis.
Well, we don't have a clear data on the matter, except that we know the COVID attacks the vulnerable people, elderly with comorbidities and renal diseases are a cause for concern in this age group.
Thank you very much, Madam Speaker, Secretary Duque. Ibig sabihin, talagang kailangan na magkaroon ng dialysis centers for non-COVID patients at hindi sila ihalo sa dialysis center ng mga pasyenteng may COVID. Kasi baka magkahawaan sila. Ang tanong ko po, ang dami pong dialysis centers na under sa PPP or Public-Private Partnership. Ang nagiging problema po dito, kahit libre na binibigay ng PhilHealth yung 90 sessions, dalawa ang problema. First, dialysis patients, renal patients, and I'm speaking on behalf of my husband who underwent renal transplant. Alam po namin napakahirap nung 3 times a week nagpupunta ka sa dialysis center at nag-aagawan ng slot. And the problem there is, that's why when I was chairman of the board, from 45 free sessions, I increased it to 90 sessions. And because Attorney Garin is here, maybe I can request him to revisit, because before I left PhilHealth, there were already documents in place for implementation that 90 sessions should have been increased to 120 sessions the next year. Kasi yan po ang minimum number of dialysis sessions that each renal patient has on an annual basis. Merong pondo po yun, galing po yun sa PD First.
Congresswoman Janet, last question na po.
Yeah, Madam Chair, if I just receive calls from some colleagues for additional questions para po sa ikabubuti ng programa, if I may be given an additional time. So yung tanong ko po, kagaya sa Cavite, sa distrito ni Congressman Remulla, ang dami pong pasyente na nangangailangan. Pero kapag po'y PPP, ang nangyayari on top of PhilHealth reimbursement, nagbabayad pa ang pasyente ng out-of-pocket na mga 3,000. That's why our direction is just for the government, because we have the sin taxes, to provide these equipments to qualified government hospitals so that we won't be tied with public-private partnership, where on top of PhilHealth, there is an additional out-of-pocket cost. And this will again point to increasing HFEP allocation. Will the Honorable Secretary and the DOH family be amenable to this?
Yes, certainly,
Secretary Duque.
Madam Chair.
Thank you very much, Madam Chair.